Hello friends, welcome to my new video, and this video is related to Aetcom. And in this lecture we will discuss about the professional qualities of the physician and what is the role of the physician in healthcare system. So at first there are the many qualities of the doctors that need to attribute if the doctors want to pursue a career in medicine. But which are the most important and why are they so necessary? So qualities like doctors should be confident in front of the patients relative and their staff members like nurses, and doctor should be empathetic towards patient, and doctor has a communication skill and he or she should be focused only on patient's care, and he or she should be quite knowledgeable, and he or she should not take any unbiased decision, and doctor should live and promotes a healthy lifestyle, and doctor should be respectful. So first of all, excellent communication skill. So good communication skills are very essential for the doctor for patient contact, to staff teamwork and to talking with the relatives. And doctor have to be able to clearly and concisely explain what is happening to your patients and ensuring that they understand what is going on, all while remaining professional and personable. And doctor also be working in a multidisciplinary team, and it is critical that you pass on information to other members of this team accurately. And frequently doctors should also come across patients who struggle with the communicating, whether it be through neurodegenerative problems, language barriers, or simply an unwillingness to divulge information. Now, second quality is that the ability to work as part of a team. Now, there is no any single doctor who works alone. Medical settings are filled with interdisciplinary teams, and doctors will have to work alongside other doctors, nurses, healthcare assistants, physiotherapists, social workers, as well as many more categories of the staff. Doctors will be working with the staff members whole the day and night. So it is vital that the doctors are able to collaborate well with other people to achieve the best for the patients. Sometimes some people of the doctor's team disagree with his or her opinion. In that case, it is important that any problems like this don't escalate, and doctors can do this by raising any concerns politely and professionally. Third quality is a strong work ethic. So being a doctor means a lot of hard work requires from beginning up to the medical education, and it certainly does not stop once you are graduate. Working long hours, evenings, weekends and holidays is hard, and that means doctors really need to have that drive to get the job done. It is crucial that the doctors are able to dedicate 100% to work despite any personal problems, how tired are they, and any plans with their friends and family that they may want to attend. Fourth quality is compassion. So being scientifically brilliant might make the doctors good at curing the patient, but without compassion, doctors will not be the best doctor. Doctors have to care about their patients. Fundamentally, a physician is someone who helps other people, and there is no way that doctors can do that job day and night. And if the doctors don't have the concerns for the welfare of the patients, a strong work ethic is vital, but the compassion is the quality that will get the doctors out of bed at 2 a.m. and when the doctors are on call to help someone that needs doctors. Fifth is excellent people skills. So this may seem like the same thing as a teamwork and communication skill, but they are subtly different. Communication skills are all about imparting information and understanding what is being conveyed to you, and having good people skills will allow you to adapt to the very type of the people. And there are no any two patients will be the same, and it is key that the doctors have the skills to get on with the people of the different ages, cultures, and from any walk of the life. Furthermore, the doctors are bound to come across patients and relatives who are distressed, angry, and maybe even aggressive. By having excellent people skills, doctors will be able to diffuse any potential problems, keeping these patients on side and building a better doctor-patient relationship. Sixth is leadership material. Being a doctor means that the buck often stops with you. There will be a time where the doctors need to make a final decision and stick with it, instructing the team members what to do and when to do. There is a lot of responsibility with this role and need to be sure that doctors are able to set up and take charge when needed. Bearing in mind this may be when you are already tired and overloaded with the jobs to do. Sometimes this decision can be hard to make and members of the team may be disagree. And it is key that the doctors are able to evaluate the situations very quickly, taking on board differing the opinion, but ultimately coming to conclusion and ensuring that your team follows along with you. And there is a fine line between authoritative and dictatorial. Seventh quality is fantastic organizational skill. As a doctor, you will be juggling many patients, possibly even on multiple wards, and maybe even at a different ends of a hospital. With the patient contact, paperwork, and meetings, it can be very easy to get overwhelmed. And this is where the organization skills come in extremely handy. Being able to prioritize which tasks are urgent and which tasks can be pushed back will make the doctor's job so much easier and ensuring that the patients receive the best quality care. Often people forget just how much paperwork is involved with being a doctor, so it is a key that you understand you will need to be able to cope up with this aspect of the medical life without losing the track of whose file is whose. And eighth quality is being academically excellent. Doctors need to learn and understand an encyclopedic amount of knowledge and being able to recall it whenever necessary and at a moment notice. And the learning does not end when doctors graduate. Medicine is constantly advancing field and doctor will need to keep on top of it throughout their career. And as a doctor, also attending seminars, doing extra reading as well as completing their study and writing papers. Now one quality is also stress management. Stress is a part and parcel with working as a doctor. Long hours dealing with the death, difficult patient, hospital issues like funding and understaffing, then little downtime, plus many other factors all combine to provide a tremendous amount of the pressure for the doctors. Quickly, doctors can find himself overwhelmed by it all unless the doctor have good stress management skills. There will be a different from person to person, but it is key that the doctors must find what works best for him to keep his head above the water in these situations. Whatever it is, ensure that the doctors able to distress so that the work does not take over their private life. Then another quality is professionalism. While a very noble field, being a doctor is still first and foremost a job, and as such being a professional is vital. That means remaining polite, attentive and well presented. Like any job, doctors can also receive the complaints and may be reprimanded for being unprofessional to both other members of the staff and patients. So it is important that the doctor can maintain a high standard of the behavior while at working place. And it is not something many medical applicants think about, but the doctors need to be able to be punctual and keep up with the paperwork, as not doing so could have serious consequences. As doctors, you might also find that the people hold you to this high standard even outside of the work. That does not mean you have to be straight as an arrow 24 by 7, but it may mean maintaining your professionalism while in public and definitely means keeping your social media relatively clean. Then another quality is patience. If you want to be a doctor, then it is vital that you have the patience that keeps you studying through the medical school and makes you willing to sacrifice parts of your personal life to go into the work on weekends and holidays. If you have that enthusiasm and intense desire, then being a doctor will be the most rewarding career for you. But without it, you will soon find yourself in a job you resent. Now, what is the role of the physician in healthcare system? So the physician provides education to patients, families and support the staff as it relates to the patient condition, diagnosis and treatment. The physician will offer resources with the information and research that patients can use to make the informed decision about their treatment plan. So this is the chart of doctor's role. So doctor should be healer, educator or scholar, researcher, planner, health advocate and as a communicator. So the role of the physician on a healthcare team is multifaceted and the physician's responsibilities are based on a regulated scope of practice. The physician is trained to provide leadership in developing and supervising the patient's overall healthcare plan. The physician's role can be divided into five general areas. The physician takes medical histories and performs a physical examination to assess the patients to determine a possible diagnosis for both acute and chronic condition. Diagnosis is a key feature of the physician's expertise in medical practice and is based on strong assessment skills. Diagnosis is a core cognitive skill based on both knowledge and judgment. The physician provides continuous care for the patient while in hospital or ambulatory setting. They manage and treat a variety of the medical conditions from minor cuts to mental health to palliative care to surgery. They are required to manage complexity and risk in situations that oftentimes are uncertain and changing. The physician works collaboratively with the healthcare team to provide optimal care. This includes providing referrals to other practitioners or services that the patients may require. They provide reports and updates of the patient's condition and needs to other services such as physical therapy, home health services and other specialists. The physician provides education to patients, family support staff as it relates to the patient's condition, diagnosis and treatment. The physician will offer resources with the information and research that patients can use to make informed decisions about their treatment plan. The physician will often teach the medical students, residents, physician assistants, advanced practice nurses and others about their area of expertise as well. The physician plays a very important role as an advocate for the patients and families. They help the patients navigate through a complex medical system to be able to obtain the most patient-centered care in a cost-effective manner. The physician works to identify and meet the needs of the individual patient and the practice population and meet the community by working with a variety of the partners in the community, public sector and hospital system. Any question? Then please write down in comment section. And if you like this content, then please subscribe my channel and please hit the bell icon. Thank you very much.